Welcome to the deep dive, the place where we really try to get past those surface level headlines and into the details that matter.
Today we are digging into something that, if you're a dog owner, is just.
Yeah,
It's one of the most alarming things you can suddenly see.
absolutely. We're talking about that moment you look at your dog and see this small, red, fleshy mass just sort of bulging out from the corner of their eye.
It's a condition that almost everyone knows by its nickname, cherry eye. And that first sight can really send you into a panic. Is it a tumor, an injury? It's very visually jarring.
It really is. So our mission for this deep dive is to pull apart the veterinary research. We want to understand what's actually happening beneath the surface. Why does cherry eye happen? Why does it seem to target specific breeds? And maybe most importantly, what is the absolute gold standard for treatment?
Right. We want you to walk away from this with knowledge that's not just interesting, but truly actionable for the health of your dog.
And I think we have to start with the formal medical term because it tells you so much right away.
It does. Medically, it's called a prolapse of the nictitating membrane. And that word prolapse tells you this isn't an infection or a growth. It's a structural failure. Something has come out of place.
And one of the most fascinating things our sources point out is who this affects. It's not a disease of old age.
Not at all. It is overwhelmingly a problem of the young. We see it predominantly in dogs that are under 1 year of age, sometimes even just a few months old.
Wow, that young.
Yeah, and that's often the first big clue for a veterinarian. When a young dog presents with this, cherry eye is immediately at the top of the list of possibilities because it points towards something developmental or hereditary.
Okay, so let's unpack that essential anatomy. To really get what's going wrong, we first have to understand the structure itself. Most people think dogs just have two eyelids, like us,
Right, but they actually have a third one. It's a crucial piece of their ocular system.
and that's the nictitating membrane we just mentioned.
Exactly. It's technically located at the inner corner of the eye, the part closest to the nose. And while you might not notice it most of the time, it's not just a flap of tissue. It's built around a T-shaped piece of cartilage that gives it some rigidity.
So it's an active part of the eye's anatomy. It does something.
Oh, absolutely. It has two incredibly important jobs. First, it's for protection. It can sweep across the cornea like a windshield wiper to shield it from dust or a stray branch. It's a rapid mechanical barrier.
A built-in shield. That's pretty cool.
It is. But its second job is arguably even more vital for the long-term health of the eye.
And that's where the moisture component comes in.
Precisely. This third eyelid houses a very important gland. It's actually responsible for producing somewhere between 30 and 40% of the dog's total tears.
30 to 40%. That's a huge amount.
It's massive. And those tears aren't just for lubrication. They bring nutrients to the cornea and wash away waste. So when everything is working correctly, this gland is tucked safely out of sight, just doing its job.
Okay, so when we talk about the prolapse, the cherry eye, what's actually happening on a mechanical level?
The word prolapse means the gland has slipped out and literally flipped over the top edge of that T-shaped cartilage. It's been pushed out from its normal protected position.
Once it's exposed to the air,
It immediately becomes irritated and inflamed. That's why it gets that characteristic red, fleshy, cherry-like appearance. The tissue is not meant to be on the outside.
and it's important to note, this isn't always just a one-eye problem, is it?
That's a great point. The sources are very clear that while it can happen in just one eye, it's often bilateral.
Meaning it can happen in both.
Yes, either at the same time or, more commonly, one eye will develop it and then the other will follow weeks or even months later. That really reinforces the idea that this is a systemic structural weakness, not just a random event.
And that brings us to the real relevance for the listener. This isn't just a cosmetic issue. It's not just that it looks bad. What is the actual risk of leaving that gland exposed?
The risk is severe, and this is where the urgency comes in. People might hope it'll just go back in on its own, but that rarely happens. If that gland stays prolapsed, two bad things start to occur.
Okay.
First, the chronic exposure to air and contaminants leads to inflammation that physically damages the delicate glandular tissue. Second, that exposure impairs its ability to make tears. Over time, the gland can stop working altogether.
And if you lose 30 to 40% of your tear production,
You are headed straight for a condition called keratoconjunctivitis sicca.
also known as dry eye.
Exactly. KCS, or dry eye, is a chronic, progressive, and frankly, painful condition. The cornea dries out, which can lead to ulcers, infections, scarring, and eventually, if it's not managed aggressively, it can even lead to blindness.
So, just to be crystal clear, Cherry eye isn't just a weird-looking lump. It's a direct warning sign for a much more serious, lifelong disease if it's not handled correctly.
That is the single most important takeaway. It is not cosmetic. It's a medical emergency for the long-term health of that eye.
That really drives home the seriousness. So, okay, let's unpack the why. If this is a structural failure, what is actually failing? Why do these ligaments in, say, a 6-month-old bulldog just give out?
That's the core question. It takes us right down to the mechanical level, to the ligaments. The gland is meant to be held in place by these tiny fibrous attachments that anchor it deep inside the eye socket.
So these are like little tethers.
A perfect analogy. They're the tethers that keep the gland tucked safely where it belongs. Cherry eye is what happens when those tethers are congenitally weak or too stretched or just poorly attached from birth.
And when the anchor fails.
The gland has nothing holding it back. It just pops out and flips over the edge of that cartilage, and suddenly you have that red bulge.
Which brings us squarely to genetic predisposition. Because the data is so clear, this is not a random occurrence across all dogs.
Not at all. It's practically built into the blueprint of certain breeds.
Yeah.
Veterinarians immediately think of it as a hereditary condition.
Yeah.
The genetic factors are just, they're profound.
So who are the main breeds we're talking about? Which dogs are in the high-risk group?
The sources consistently point to the brachycephalic or short-nosed breeds. They have the highest incidence by far.
So bulldogs.
English and French bulldogs are probably the poster children for this condition, but we also see it very, very frequently in Cocker Spaniels and Beagles as well.
Let's dig into that anatomical link a bit more, especially with the bulldogs. It's not just that their faces are flat, right? Their whole skull is different. How does that specifically lead to this ligament failure?
It's all about the architecture of the skull. Think about the eye socket, the orbit. In a dog with a more traditional snout, like a Labrador, the eye sits deep inside a cone-shaped socket.
Which gives it protection.
Protection and stable anchor points for all those ligaments. Now, in a bulldog, the whole skull is compressed. It's shorter and wider. This leads to a much shallower eye socket.
So there's just less space. Yeah. And everything is sort of pushed forward.
Precisely. The bony structures where those ligaments are supposed to attach are in a different position. The ligaments themselves might be shorter, weaker, or just under constant strain from day one because of the anatomy.
And you add in the fact that many of these breeds have those large, slightly bulging eyes.
Right, a condition called lagophthalmos. That can put even more forward pressure on the gland. So you have weak anchors and constant pressure pushing from behind. It's a recipe for failure, especially when the puppy is young and its connective tissues are still developing.
So the structural weakness isn't just bad luck. It's an almost predictable outcome of the breed standard we've selected for.
In many cases, yes, but it's also important to look at other contributing factors. Heredity is the main driver, but other things can influence when and if it happens.
Are we talking about things like inflammation?
Primarily, think about a dog that has chronic eye irritation, maybe from allergies or dust. That constant low-grade inflammation can further weaken those already compromised ligaments.
So if a dog is already genetically on the edge, the chronic irritation is like the little push that sends it over.
That's a great way to think about it. Chronic inflammation releases enzymes that can degrade connective tissue over time, so it can absolutely accelerate the timeline for a prolapse.
And you mentioned age again. The fact that it happens in young dogs is key.
Yes, the peak incidence is in dogs under a year old, which really suggests it happens before those ligaments have a chance to fully mature and strengthen. It's a developmental window of vulnerability.
It sounds like there's no single definitive answer. It's more of a perfect storm.
It is. The research is still clear that we don't know exactly why one puppy in a litter gets it and another doesn't, but it's this complex mix of genetic destiny, anatomical structure, and then potentially some environmental triggers on top of that.
Okay, now let's move to recognition. For a pet owner at home, that primary visual symptom is pretty hard to miss. But let's get into the details of what they're seeing and, just as importantly, what the dog is feeling.
Right, so the main thing you see is that sudden appearance of a reddish or pink, round, smooth mass popping out of the inner corner of the eye. It can be the size of a pea or even a small grape.
I can easily see how someone might think their dog just got a piece of food or something stuck in its eye.
That's a very common first thought. But the key difference is that this is attached. It's living tissue. You'll also notice the affected eye might look less open, or it might have a general bulging appearance. It just changes the whole expression on their face.
And beyond just seeing the cherry, what are the other physical signs that tell you the dog is in active discomfort?
You want to look for excessive tearing. The medical term is epiphora. The eye is trying to flesh out what it thinks is a foreign object.
And does the discharge change over time?
It can. Initially, it might be clear and watery, but as the exposed gland gets more irritated, or if a secondary bacterial infection starts to develop, it can become thicker, more like mucus, sometimes with a yellow or greenish tint.
And the dog will try to protect its eye, I assume?
Yes, absolutely. You'll often see them squinting a lot. That's called blepharospasm. And they could also become really sensitive to light, a condition called photophobia.
So they might avoid bright rooms or sunlight.
Exactly. That exposed, inflamed gland is very sensitive, and bright light can be painful, so they'll shy away from it or blink constantly when they're outside.
Okay, and this is where it gets really interesting for me. The behavioral red flags. The things the dog does that tell you it's really distressed.
This is so important. The behavior is the dog trying to tell you it needs help. The most obvious sign is frequent pawing at the eye. But the most specific and, frankly, most alarming behavior is aggressive rubbing.
You mean rubbing their face on the carpet or the couch?
Or grinding their face into your leg.
Yeah.
This isn't just a casual itch, it's a vigorous, almost frantic rubbing. They're trying to relieve that constant irritation, or maybe even trying to physically push the mass back in.
And that's incredibly dangerous.
Extremely, because that rubbing can cause serious self-inflicted damage. They can scratch the gland itself, or worse, they can cause a corneal abrasion or even a deep ulcer on the surface of their eye, which is a whole separate medical emergency.
So seeing that aggressive rubbing is a signal that you need to get to the vet immediately.
It's a 5-alarm fire. It tells you the dog is in significant discomfort and is at high risk of complicating the situation severely.
Are there any more general signs, like changes in their overall mood?
Sometimes, yes. If the pain and irritation are constant, you might see the dog become a bit lethargic. They might sleep more or show a reduced appetite. It's just hard for them to relax and go about their normal day when their eye is bothering them that much.
So it's really about connecting the dots. You see the cherry, you see the discharge, you see the squinting, and then you see the rubbing. And altogether, that paints a picture of acute distress.
Precisely. The rubbing, in particular, tells you the level of irritation and the risk of secondary damage, and that should really light a fire under you to make that vet appointment.
Okay, so you've made the appointment. Given how many things can make a dog's eye red, how does a veterinarian make a definitive diagnosis and rule out other, more sinister things?
The process always starts with a really thorough physical and specifically an ophthalmic exam. Now, the visual of a classic cherry eye is often what we call pathognomonic, meaning it's so characteristic that it's almost certainly the diagnosis.
But it can't just assume.
You can never just assume. The vet has to confirm it and, crucially, rule out other possibilities. And that's where taking a detailed history from the owner is so fundamental.
What kind of questions are they asking?
They'll want to know the timeline. When did it appear? Was it sudden? Does it seem to get bigger or smaller? And what about the discharge? Has it changed? This history helps the vet distinguish it from something like, say, severe conjunctivitis or even a tumor, which is more of a concern in an older dog.
So once they have the history and the visual, what are the actual diagnostic tools they use to get hard data?
To get that baseline data and confirm everything, there are a couple of key tests. The single most important one is called the Schirmer tear test, or STT.
Okay, explain the STT. What is it measuring and how does it work?
The STT is a simple, non-invasive test that gives us an objective number for tear production. The vet places a small, standardized strip of filter paper inside the lower eyelid for exactly 1 minute.
And the tears wick up the paper.
Exactly. And the strip is marked in millimeters. A normal reading for a dog is generally anything above 15 millimeters of wetting in that minute.
And what's a low reading?
If the reading is low, say under 10, it tells us the dog might already have some degree of dry eye syndrome, or KCS. This is critical information to have before surgery. It tells us the health of the glands at that moment.
That makes sense. You need a baseline. What about checking for that self-inflicted damage from all the rubbing?
For that, we use fluorescent staining. A special dye, fluorescein, is applied to the surface of the eye. This dye won't stick to a healthy cornea, but if there's an abrasion or an ulcer, an area where the top layer of cells is scraped off, the dye will adhere to it and glow bright green under a special glue light.
So it instantly highlights any damage.
Instantly. And it's so important to find those ulcers because they require their own specific immediate treatment, sometimes even before you can proceed with the cherry eye surgery itself.
So the whole process is very structured. History, visual exam, test the tear function, and then stain for damage. It's a lot more than just looking at a red lump.
It's a complete assessment of the entire ocular environment, and that's why our sources are so emphatic with their warning. Self-diagnosis is not recommended.
Right, because you can see a red eye and think it's just a simple infection, start putting in some old antibiotic drops.
When the real problem is a prolapsed gland or a deep corneal ulcer. And that kind of mismanagement can lead to irreversible damage, like the permanent loss of that tear gland. Professional diagnosis is absolutely essential for a good outcome.
So the diagnosis is confirmed, it's a prolapse, the consensus is clear. Surgery is the way to go to save that tear function. What is the gold standard surgical approach?
The gold standard is all about repositioning, not removal. The problem is mechanical. So the solution has to be mechanical. And the goal is not just to make the eye look normal again, but to preserve that vital tear-producing gland.
Let's get into the specifics of the techniques. You mentioned repositioning. What does that actually look like?
The most common and widely successful method is called the Morgan pocket technique.
The pocket technique.
Exactly. The surgeon makes a small incision on the surface of the third eyelid and creates a little pocket in the tissue. The prolapse gland is then gently tucked down into this pocket.
So the surrounding tissue becomes the new anchor.
Precisely. The pocket is then closed with very fine, dissolvable sutures. This effectively buries the gland back where it's supposed to be, allowing it to heal in its natural position and, hopefully, resume normal tear production.
This brings up an important point about the history of this surgery. It used to be common practice to just cut the cherry off, right?
Regrettably, yes. Years ago, resection, literally snipping the gland off, was a common procedure. It was quick and it fixed the cosmetic problem. But we now know from decades of data that it was a disaster for the long-term health of the eye.
Because you're guaranteeing dry eye down the road.
You are guaranteeing it. By removing that gland, you're permanently removing 30 to 40% of the dog's ability to make tears. So modern veterinary ophthalmology absolutely mandates gland preservation. The goal is always to save it, never to remove it.
So with these modern repositioning techniques, what are the expected outcomes? Is it generally a one-and-done fix?
It's generally highly successful. The vast majority of dogs get significant relief from the irritation and discharge very quickly. The recurrence rate, meaning the chance of it popping out again, is pretty low after a well-performed surgery, usually under 10%.
But it's not zero.
It's not zero. Success really depends on a few things. The severity of the initial prolapse, how long it was out, and honestly, the skill and experience of the surgeon. This is delicate work.
And what about non-surgical options? Is there ever a time when you can just manage this with drops?
It's really not a long-term solution. Using things like topical anti-inflammatory drops is purely palliative. It might reduce some of the swelling and make the dog feel a little better for a short time, but it does absolutely nothing to fix the underlying mechanical problem. The broken ligaments are still broken.
So it's just a temporary Band-Aid.
It is. The only time we'd really consider it is if a dog is, say, extremely old or has a severe heart condition that makes anesthesia too risky. For virtually every young, healthy dog with this condition, surgery is the only responsible path forward.
Okay, let's move to that critical recovery phase. The surgery is done. What are the absolute non-negotiables for an owner to make sure it's a success?
Post-op care is just as important as the surgery itself. First and foremost is pain management. You have to give the prescribed pain medications exactly on schedule. And you need to watch for subtle signs of pain whining, being reluctant to eat, or pulling away when you touch their head.
And what about protecting the site? That rubbing instinct isn't just going to disappear overnight.
No, it won't. So site protection is paramount. This means the dreaded Elizabethan collar, the cone of shame.
Nobody's favorite accessory.
Nobody's. But it is absolutely critical for 10 to 14 days. It physically stops the dog from scratching or pawing at their eye, which could easily rip those delicate sutures and cause a complete failure of the surgery.
And no rubbing on the furniture.
No rubbing on anything. You also have to keep the surgical site clean and dry. And then there's activity restriction.
Right. No rough play with other dogs, no jumping off the couch.
Exactly. Strenuous activity can increase blood pressure and pressure within the eye, which puts stress on the repair. The dog needs a calm, controlled environment for at least a couple of weeks to really let things heal properly.
And of course, follow-up visits with the vet are key.
Non-negotiable. The vet needs to check on the healing, make sure there's no infection, and ensure the repair is holding. And because there's always that small risk of recurrence, and because the other eye is also at risk, long-term care really involves just being vigilant and having regular eye exams.
So we've covered the problem and the fix. Now let's talk about the future. For someone considering getting a high-risk breed, or who already has one, can we actually prevent this? Or is it just genetic destiny?
That is the ultimate challenge, isn't it? And we have to be honest. Because the root cause is genetic and anatomical, you may not be able to prevent it entirely in every single at-risk dog, but you can absolutely take proactive steps to significantly reduce the risk.
So let's start with what feels like the most powerful tool: breed selection and doing your homework.
It all starts there. Before you even get a puppy, you have to research the breed's predispositions. We've said it a few times, but it bears repeating. Bulldogs, Cocker Spaniels, Beagles, you have to go in with your eyes open knowing that this is a possibility.
And if you are set on one of these breeds, what should you be asking a breeder?
You should be looking for a responsible breeder who is aware of these issues, who screens their dogs, and who is actively trying to breed for better health, not just for more extreme features. Ask about the history of cherry eye in their lines. A good breeder will be transparent about this.
Okay, moving to the next strategy: diet and nutrition. How can what a dog eats actually affect the ligaments in its eye?
This is about giving the body the best possible building blocks to work with. We're talking about supporting the integrity of all the connective tissues in the body.
So what specific nutrients are we talking about?
Things that are crucial for collagen synthesis. Vitamin C is a big one, as are minerals like zinc and copper. They're all cofactors in the processes that build and strengthen tissue. And a really important one is omega-3 fatty acids.
Because of their anti-inflammatory properties.
Exactly. We already established that chronic inflammation can weaken these ligaments. A diet rich in omega-3s can help keep that systemic inflammation at a low level, which might give those ligaments a better fighting chance. It's about maximizing the tissue strengths that their genetics will allow.
And the final proactive strategy is about routine care and managing their environment.
Yes, this is all about reducing those external triggers, those irritants. This means routine grooming and, specifically, daily eye cleaning with a vet-approved saline wipe or solution. You want to gently clear away any debris or hair that can collect in that inner corner of the eye.
What about things inside the home, like air quality?
That's a great point, especially for the brachycephalic breeds. If you live in a very dry climate or run the furnace a lot in the winter, the air can get very dry. Using a humidifier where the dog sleeps can help keep their eyes from drying out and getting irritated.
So less irritation means less rubbing, which means less stress on those ligaments.
That's the idea. And of course, being mindful of other irritants like strong cleaning sprays, air fresheners, or cigarette smoke. Anything that can cause that low-grade chronic inflammation is something you want to minimize.
So to sum it up, you can't change their DNA, but you can make informed choices about breeding, you can support their tissues with nutrition, and you can control their environment to reduce inflammation.
Exactly. It's a multi-pronged approach. And taking all those steps together gives your dog the absolute best chance of avoiding this, or at least minimizing its severity if it does occur.
That brings us to the end of this really detailed deep dive. We've covered the mechanics of the nictitating membrane prolapse, we've flagged the high-risk breeds like bulldogs and beagles, and we've hammered home that surgery, specifically repositioning, is the only path to saving tear function and avoiding KCS. So our final thought for you, the listener, to really mull over is this. Now that we know, from veterinary research, the direct line between the physical features we select for in breeds, the flat faces, the shallow orbits, and the high likelihood of a painful condition that requires surgery, what ethical responsibility do we have as the people who choose and buy these dogs to demand and support breeding practices that prioritize health over extreme aesthetics? How can our choices help shape a healthier future for these breeds? That's something we're thinking about long after this is over.
A provocative and very necessary question to end on. Thanks for joining us for this deep dive into canine eye health.